Hey, Doc.
Hey, Dr. Asia, how are you doing?
I'm good. How are you doing?
Good. I'm excited to do this podcast with you today.
Yes, same. I'm so excited to talk about this topic today.
Yes, absolutely. And to you guys joining us, welcome to the Functional Solutions podcast. This is brought to you by this background here, the American Academy of Functional Health. My name is Dr. Chill, and this is Dr. Asia.
Hello, hello.
So, if you are looking to learn a lot more about the root causes of chronic diseases, all of the practical tools to help your patients improve their health, you are in the right spot. Each week, we are going to explore some practical, science backed strategies. This is really to help advance the field of functional medicine, and it's going to provide you with some clinical strategies that you can apply to help your patients right away. This week, we are going to be talking about a super popular topic. It's natural alternatives to GLP-1 agonists. This is the leading weight loss medication. You have probably heard of this, so we wanted to give you a little bit more insight from a functional medicine perspective on GLP-1. I'm sure you are being asked about this all of the time. I'm sure you have patients, friends, family members that are on some sort of GLP-1. So we want to dive into this topic. Are you seeing this with your patients, your friends, your family members, Dr. Asia?
Oh yeah, I mean, I think it's like the hot topic now. I think that I'm always stuck in gut world, so I'm always like, oh, gut is the hot topic, but I'm like, oh my gosh, gut is losing its shine, and now it's all the GLP-1s. Yeah, it's really interesting, just the standardized kind of conversation around it. But then, like, even there's like a micro dosing community popping up around GLP-1s for longevity science, not necessarily even for metabolic components. So, really cool to see where we go in the next decade or so with the GLP-1 world and things of that nature. But yeah, it's like hot topic, I think, in medicine, the hottest topic right now.
It really is. And we want to provide you with some strategies to help your patients, especially because this is a functional medicine solutions podcast. We want to give you what we're seeing in the clinic. We're working with practitioners on a daily basis as well, and what they're seeing and what we're kind of providing for them with the strategies. Now, why we chose this topic. The CDC, obviously, it's a hot topic, as Dr. Asia was saying. But the CDC reported that about 7 out of 10 adult Americans are either overweight or obese. And according to the American Psychological Association, they found that 42% of adults reported unwanted weight gain after the pandemic, with an average of 29 pounds. So this is a very high demand, specifically for weight loss solutions. And when you look at the data, you can see that Americans spend a lot of money on weight loss therapies. You probably are seeing this with your patients. Probably a handful of your patients, a quarter to half of your patients are wanting to lose some weight. And you can see, for example, with weight loss supplements, the Federal Trade Commission reported that Americans spend about 36 billion, the word
Wow.
billion, every year on weight loss programs, diets, and supplements. And then every day there are 700, and they pulled over 1,500 respondents, and this includes 6% of people currently using GLP-1 agonists, such as semaglutide. It's marketed as, you've probably heard it in your commercials, Ozempic or Wegovy. And so let's show a little track on that. There is a little image here, so you can see this a little bit more. And this is why adults say they have ever used a GLP-1 agonist. About 12%, 43% have diabetes, 26% is for heart disease, and 22% is because of weight imbalances. So Dr. Asia, this is pretty important and pretty massive, right?
Pretty massive, pretty astounding when you think about it. And um, it makes sense though, right? Because we have so much metabolic disease, metabolic syndrome. So, and when you think about the history of health and disease in America, we've pretty much been dying of heart disease, right? Which has a large metabolic underpinning. So it makes sense that, you know, the GLP-1 agonist and GLP in general has taken off. And it's even more fascinating, I think, that this is something innate that we can produce. So I'm really excited to talk about, you know, just supporting that picture as well. So
absolutely. I think the biggest thing is people don't understand that it's innate, right?
Exactly.
And that we are producing it. And
Yep.
your favorite topic, gut health.
Yes.
And our favorite topic in functional medicine, gut health, and why that is being promoted, or why we're having that innate ability to GLP-1 and creating that ourselves, right? Or what the imbalances are showing that where we're not creating it. But GLP-1, if it's used correctly, it's great, right? It's helping with heart disease, diabetes, with overweight and obesity. It's when it gets overused as often as like what usually occurs with medication is it gets overused, right?
Exactly.
And that's what we're kind of seeing right now.
Yeah, you see the overuse, you see the plateau, you see, you know, people not really experiencing any effects from it. They get to a certain amount or certain dosage. So I think that with, you know, the art of medicine, there's always a nuance in all the things that we do, but it's really cool that we're able to synthesize this within our own system. So we're not completely dependent on, you know, external components to get this benefit. So yeah, you know, let's talk about what is GLP-1. What does it mean? Let's break it down a bit. So GLP-1 stands for glucagon-like peptide 1. Like we said, it's naturally produced in the gut. It's a hormone naturally produced in the gut. Plays a key role in regulating blood sugar, insulin secretion, and what's been getting the most attention lately, appetite and satiety. When GLP-1 is released, usually after we have a meal, it helps to slow down how fast the food leaves the stomach, and it sends signals to the brain to let us know, hey, that we're full. So to get a better view of this, let's take a look at this image from a 2023 review article in Nature Reviews Cardiology. So many researchers have investigated the mechanism of action of the GLP-1 protein, and you know they've concluded that it acts on these four main areas of the body, which is what you'll see here. So you see the blood vessels, you'll see the GLP-1 and GLP-1 receptor agonist, which is like right in the middle. And you see that kind of peptide little snake-looking thing figure. So it acts on their blood vessels, so reducing blood pressure. You see the action on the gastrointestinal tract, so slowing gastric emptying, reducing chylomicron secretion, and then these are going to lead to some of the adverse events you typically hear with the GLP-1s. Nausea, so when things are moving slower, they're just kind of hanging out in the belly a little longer, that can make you queasy, make you kind of have more nausea, diarrhea, vomiting, and then some biliary gallbladder disorders. And then we see, as it relates to the pancreatic islet cells, specifically the GLP-1 receptor agonist, can increase insulin secretion there, increase somatostatin, reducing that glucose and reducing that glucagon. So it has a direct effect in kind of that main blood sugar organ, if you will, the pancreas. And then on the brain, like we mentioned, the satiety impact, there's a reduction in appetite, but how does that happen? Or what does that lead to? So that reduction in your appetite then leads to obviously less caloric intake. So you see the adipocyte, the fat cell, actually getting smaller. So it's a little larger on that bottom right. And then it kind of goes to a smaller size. So it shrinks. You see less adiposity, body weight goes down. And then, you know, inflammation naturally goes down as well with that. So they're really kind of fascinating in all the organ systems that are being worked on by the GLP-1 hormone. Now, like Dr. Chill mentioned, the pharmaceutical versions we see everywhere, the Ozempics, the Wegovy, the commercials, the, you know, get it online, you know, all the ways you can kind of find GLP-1 marketing these days. GLP-1s are basically mimicking this hormone, and they're heavily promoted as just like a magic bullet for weight loss because people get on them, they lose weight fast. Women are having, you know, more babies because there's the reduction in weight, inflammation that can improve fertility. So really fascinating. And we think why? Because they work, and at least in the short term, people are often experiencing reduced appetite, less emotional eating. I hear people, I follow the comments on social media sometimes. People will say, oh, there's less food noise. You'll hear that. I'm not thinking about eating all day. And then also obviously some significant weight loss. But the thing is, they don't really address the why behind the weight gain, things like stress, right? Insulin resistance, inflammation, hormone imbalances, gut health, and emotional eating patterns. So they're very useful medications that can have a really beneficial outcomes in the long run for metabolic pictures, but they're not necessarily the whole picture. And with functional medicine, we want to focus on those root causes and help kind of make sustainable changes without relying on lifelong medications. So that's just kind of a simple breakdown of GLP-1s and the tissues that they work on, how they work. Let's do a quiz to kind of test our knowledge. So what is the primary reason GLP-1 medications like Ozempic and Wegovy are promoted for weight loss? A, they speed up metabolism. B, they suppress the immune system. C, they're mimicking a natural hormone that reduces appetite and slows stomach emptying. Or D, they block fat absorption in the gut. Give you a few seconds. If you chose C, you're correct, mimicking a natural hormone that reduces appetite and slows stomach emptying. So Dr. Chill, I think that it's so fascinating all the ways that GLP-1s work on the system. And, I think that this speaks to the effects largely. A lot of people that I see who are on them obviously have reduced appetite, reduced caloric intake, and they're seeing a lot of those benefits coming through. But I want to pass it to you so we can talk more about how the GLP-1s are working.
Yeah, I love that you touched upon the holistic look at this, right? You're seeing a lot of patients that are on this, but they're not really addressing all of the root causes to their metabolic issues.
Right.
And I actually noticed this even with our patients, and when I'm working with practitioners, what I'm seeing a lot is the patients who are on these GLP-1s, they might not have a lot of appetite, but what are they still eating?
Exactly.
I'm still seeing them eating the fast food. They might not eat as much of it, right? It might be half of that Whopper or half of that Big Mac, but they're still eating that. Nothing has changed within their lifestyle, right? And over time, this is where we start to see the issues. We start to see the nutrient deficiencies. We start to see the other issues because they're not addressing them.
That's right.
Diabetes can still occur, right? Blood sugar irregularities, adrenal, hormone issues can still occur. Gut issues can still occur because they're not looking at all of those things.
When you say that, I just thought, I wonder if there are any studies coming out or already out about just kind of micronutrient deficiencies in people who've been on the GLP-1s for 6 months to a year. If you're eating less food, you're eating less nutrients, right? So then what's really happening and what does that look like in the long run? So
it's interesting you say that because I just worked with a few practitioners and they have patients that are on GLP-1 agonists and they ran a couple of micronutrient panels on them and they were deficient.
Wow.
In many of the vitamins, the B vitamins, a lot of the antioxidants, a lot of the omegas, their omega ratios were way off, right? We talk about this in another podcast and in our program a lot. The ratio between omega-3s and omega-6s and their omega-6s are extremely high. They're starting to see them at 60-to-1 ratios.
Wow.
Which is really
That's
really
shocking. And it makes me wonder, are we actually reducing heart disease risk, with reducing the metabolic picture? Are we kind of fueling it in a different way? So
it's going to be interesting to see what happens with this in the future. And we're already seeing this, right? Because we're on the front lines with the functional medicine, because we're getting those patients that are starting to have issues with these GLP-1s, or they're wanting another option. And that's why we're kind of talking about it. So I'm glad we're doing that.
Thanks for sharing that.
Yeah, absolutely. So now let's just dive into, we want to go into how this works even a little bit more, because you may be surprised at how many patients are unaware of how this actually works, and they just want to get on this medication, right? So we want to talk about what is actually occurring. And as Dr. Asia was saying, it's mimicking an action of a hormone that our body already makes, GLP-1 or glucagon-like peptide 1. This hormone is released in the gut, and this is in response to eating. It sends a message to the brain. It tells the brain that I'm full. This is what Dr. Asia was saying, that it really helps with appetite control. It also, one of the major factors is that it slows down how quickly food leaves our stomachs, right? This is going to help these patients who are on it stay fuller longer. It can help with improving insulin sensitivity and can help with balancing blood sugar as well. Let's dive into this a little bit further, and we're going to take a look at an image. And this was done in the International Journal of Molecular Sciences, and this was in 2022. You probably see a lot of colors here, the red, the blue. There is a reason for that. What you're seeing in the red color represents the indirect effects of GLP-1, right? We're seeing in the muscle there on the bottom, we're seeing an increase in insulin sensitivity, increase in glucose uptakes. These are indirect effects of GLP-1, and this is on the determined organ. On the blue color, this is going to represent the direct effects on the organ system. So in the pancreas there on the left-hand side, we're seeing increases in insulin secretion and synthesis. We're seeing decreases in glucagon release, increases in beta cell survival, and increases in beta cell proliferation. These are all helpful for insulin, blood sugar regulation. And then you're also seeing a mix where you see a mix of the red and the blue. What that is representing is determining the effects in indirect and direct related GLP-1 activity. So it's really interesting when we're taking a look at all of these organ systems and how GLP-1 is impacting all of these organ systems, right? From the kidneys to the heart to the brain, the GI tract, obviously, the liver, the fat cells, the muscles, and the pancreas. So we know that the medication is working, but we also know that GLP-1 is innate in us and is being made in our gut if our gut is in good repair or is in balance. But with these medications, it's really about amplifying all of these signals that we're seeing there, right? It really is tricking the body. That is the key word here, and thinking it's full more quickly and for longer. And this is going to reduce the appetite. It's going to lead to fewer calories consumed. And then some versions also impact other hormones involved in blood sugar control and fat storage. But here is the catch of all catches. While they help with weight loss, especially with people with insulin resistance, type 2 diabetes, they do not address the root causes like poor sleep. We keep mentioning this, right? Root causes of everything. It's still there. This is just a band-aid to what is actually occurring with their metabolism, right? When their poor sleep is not being addressed. Their chronic stress, their HPA axis is not being addressed. Their gut function or dysfunction is not being addressed. Their emotional eating. And most people will regain the weight. This is by many of the studies that are starting to come out when they stop the medication, unless those underlying issues are addressed. This is where we as functional medicine practitioners come in, and we're going to get to the root causes, the why of their weight imbalances or their inability to lose weight. And we're going to address those root causes. And this is going to be more of a long-term healthy approach to metabolic dysfunction. And on top of that, there's a lot of side effects, which Dr. Asia is going to get into for you guys.
You talk about kind kind of stopping it, and the weight gain comes back, and all the literature that'll come out there. I wonder kind of what the school of thought is, if it, if the GLP-1 agonist will become like, NSAIDs, right? Where you can just kind of take them long term. Well, actually, that's a terrible example, actually, or just some type of like a thyroid pill, right? Or something.
Right.
They're just like recommended long term and just like a lifelong type of protocol. I could see something like that happening, because I think that just some of the benefits people have gotten, they just are addictive, right? At this point, some of the GLP-1 medication. So hopefully, with functional medicine, integrative medicine, we can really kind of push out those tools to, like you said, support those root causes like the sleep and gut dysfunction. So yeah, thanks for that deep dive. Really interesting image you shared there.
And really, we can actually look at this as maybe a good jumpstart for people, but not the end all, right?
Right.
This can be a jumpstart while you're addressing the root causes. We have a lot of integrative practitioners in our program as well that are MDs that do a mix of prescription medications, but they're wanting to wean them off those medications. This is a perfect example of that, right?
Nice.
This could be what's considered a weight loss program where they can do a jumpstart with these GLP-1 agonists while they're addressing their root causes, and then transition into more of the functional medicine approach.
I love like any type of like bridging approach. I love that, because it helps to get them the results so they can see, be motivated, keep going while you're working on those kind of root causes. That's really cool. Okay.
Absolutely. And there's side effects. This is what they're seeing as well with this long-term use.
Yes. Let's talk about some of the side effects. So potential problems and side effects of the GLP-1s. Before we dive into the problems, let's summarize the function of GLP-1s with a little quiz. Which of the following is not a primary way that GLP-1 agonists support weight loss? A, slowing stomach emptying. B, reducing appetite by signaling fullness to the brain. C, improving insulin sensitivity. Or D, blocking the absorption of dietary fat. So a couple seconds there. Okay, correct answer is going to be D. So while these drugs can be effective for weight loss, like we've mentioned, they're not without risk. The most common side effects are going to be what we know, GI, right? Nausea, vomiting, diarrhea, constipation. Because remember, they're slowing down the gastric emptying. They're slowing down how food moves through the digestive system. So according to an article published in the New England Journal of Medicine in 2022, 1 out of 3 patients report nausea. So that's like 33% of people on a GLP-1 reporting nausea. Some people actually develop gastroparesis, which is delayed stomach emptying, to the point where it causes bloating, pain, poor appetite. And gastroparesis can become a long-term issue even after stopping the medication. When I was in the GI clinic, we saw a lot of gastroparesis patients, and it's such a naughty kind of a side effect of a medication a lot of the times, or sometimes it's like due to metabolic issues, but it can be really troubling for patients because it causes so much GI distress. And so, to know that these medications can possibly cause this issue and then it continues after stopping the medication, it's a little concerning. So let's take a look at this image from the 2024 Gastroenterology Insights. It's looking at GLP-1 receptor agonists and associated side effects and potential concerns, right? So you'll see just a list of them. GI effects, which we already mentioned, oncological, more so increased risk, thyroid cancer, medullary thyroid cancer, glycemic considerations, right? So blood sugar going too low, hypoglycemic events, especially when combined with other drugs patients may be taking for metabolic disorders. Pancreas, we see here as it relates to the pancreatic side effects, more so elevated pancreatic enzymes, possible pancreatitis, inflammation of the pancreas, cholelithiasis, so gallstones, and with the rapid weight loss, you'll see allergic immune responses at the very bottom left, antibody formation, possible hypersensitivity, rare severe anaphylactic responses. And at the very top, the facial, more derm related, skin sagging, amplified visibility of wrinkles, depletion of facial fat, collagen, and elastin. It's really interesting. I think also what should be on this list, which I don't see actually, is hair issues, I've seen a lot of people who use GLP-1s and they have terrible hair thinning and shedding. And I don't know if it's the medication of the side effect or if it's just a concern because maybe there's less caloric intake, less protein intake, and hair is mostly protein. So your body is now trying to prioritize the nutrition that is getting in and sending it to, your major organ systems. And hair is just not important when you're in your body's in a crisis mode, trying to figure out where to place nutrition. So I would say even including hair issues here. But outside of that, you see renal, right? Possible correlations with these meds and acute kidney injury, other kidney issues as well. We kind of mentioned the derm, but I guess it's here again. Rash, erythema, itching, potential for transient bumps and paniculitis with certain formulations, and then cardiovascular increase in heart rate. And then lastly, musculoskeletal possible association. So just different impacts on bone fracture risks, which is really interesting, actually. So these are some of the side effects. There are also concerns about nutrient absorption, especially those fat-soluble vitamins, your A, vitamin D, vitamin K, vitamin E, which may be impacted by a slower digestive process. Plus, like we kind of mentioned earlier, there's a deeper issue at hand. Many people become dependent on the medications without making those lifestyle changes. And once they stop, like Dr. Chill mentioned, the weight tends to come back. And this can just be emotionally discouraging and even hard on on the metabolism, kind of having this up and down effect, yo-yo effect, they call it, of metabolism can just kind of challenge your system in different ways. So, these medications, while they are potent, while they are quite efficacious, and lead to improved metabolic outcomes a lot of the time, they're not without risks, they're not without side effects, and you have to weigh those side effects in context with your patient's current metabolic state or current baseline for health. Did this person have a history of renal issues? Does this person already have issues with musculoskeletal bone density? So it's a little complex when you think about patient populations that you would use these medications in, because a lot of us already have underlying health issues that we are also working on. So enough about the side effects. Let's do another quiz. So which of the following is a major problem when using the GLP-1 agonist medications? 1, constipation. 2, gastroparesis. 3, reduced nutrient absorption. 4, nausea. 6, they don't actually address the root cause of weight gain. Wait, that was 5. And then 6, all answers are correct. So I think we all know that number 6 is right. All of these answers are correct. They can all be major problems with patients taking GLP-1 agonists, and they can be really terrible problems to have. I mean, nausea, and then constipation on top of that. So definitely some risks to think about and discuss with your patients if they're using these medications. So all of these are potential side effects. However, like we mentioned, one of the biggest problems is like, what happens when I stop it? Will I gain all the weight back? And typically weight gain is a symptom of unhealthy lifestyle, metabolic dysfunction, gut dysfunction, environmental pieces that we're missing out on. So if we're not really addressing the root causes to begin with, the patient could, stop the medication and regain all that weight and just continually spiral, losing their metabolic picture on this kind of up and down yo-yo of metabolism. So, this is just one little snippet. If you're interested in learning more about the root causes of chronic metabolic and autoimmune conditions, we do have those advanced the modules in the advanced clinical functional medicine program where we dive into the root causes and the testing to do, the functional lab testing, personalized treatment protocols, and whatnot. So yeah, I mean, we can take a deeper dive. You can take a deeper dive, but this is a fascinating topic when you think about the GLP-1s. And we'll probably, well, not probably, but after this, we'll talk about, Dr. Shill's going to talk about just dietary methods to support your natural GLP-1 secretion. So
now that we've gone into the pathophysiology, the side effects of GLP-1, what we should be explaining to our patients anyways, let's talk about some of the why we're here, right? It's the natural solutions and some of the alternatives. Obviously, we talked about GLP-1s helping with appetite control, blood sugar balances, insulin sensitivity, but sustainable weight loss, right? We could do this without relying on a prescription. And that's what all of these natural alternatives are about. So let's talk about first the dietary methods to support GLP-1. Again, this is meant to help with appetite regulation, blood sugar balances, insulin sensitivity, and then a sustainable weight loss picture. The first thing that you should have your patients do is incorporate fiber-rich foods and protein. These are foundational. They both slow stomach emptying. They keep us fuller longer. And this is similar to what GLP-1 does. Think chia seeds, lentils, wild-caught fish, and quality plant proteins. Now, if you're looking at supplementation, you can look at things like gymnema, cinnamon, and bitter melon. These help to regulate glucose and cravings. And then adaptogens like ashwagandha and rhodiola. This can support stress responses. These are all key since stress and cortisol dysregulation often drive emotional eating and fat storage. These are just different aspects that you can start to think of for your patients as an alternative to GLP-1 or without relying on that prescription long-term, or what we were talking about before, right? Maybe doing a jump start with the GLP-1 agonist and then bringing in these approaches and addressing these underlying causes as well, right? The rich foods and the proteins, again, those are being foundational. This is addressing some of the maybe gastrointestinal issues that they may be having. This may be addressing some of nutrient deficiencies they may be having. The appetite suppressant with the gymnema and cinnamon and the bitter melon, the cortisol responses with the ashwagandha. And now we're starting to look at everything in a more comprehensive picture, right? We're looking at the root causes as to what's happening, the contributing factors, and starting to address them. Now, Dr. Asia, what else are you seeing from alternative perspectives or natural perspectives?
I would say the fiber is the largest thing I've seen. I've even seen like there's a group that does education for physicians, like CME Credit. I think it's out of Harvard or something. They were even talking about fiber as a natural GLP-1. So I was really impressed to see that in some of their CME education. But fiber is a really big one. The berberine is a really big one as well that I'm seeing. Gymnema, of course, and then probiotics, certain microbes as well, specifically. So, yeah, I mean,
all of these are related to the gut.
Yeah, exactly.
GLP-1. It helps with regulating the gut, right?
Yes.
Putting it back into balance. And when it's back in balance, you're producing your own GLP-1s.
That's right. So the gut is still in, as you see.
The gut is still in.
So, like Dr. Chill mentioned, there are nutritional methods and there are herbs. There's nutrients. We talked about berberine. Let's talk about it a little bit more. Berberine, for example, supports insulin sensitivity and blood sugar control. I want to pop in this image from an animal study published in the Journal of Endocrinology. So these diabetic rats were, and I'll get to the actual graphs you'll see here. Diabetic rats were fasted for 8 hours, after 2 hours, and at 2 hours after oral administration of berberine. And you'll see the berberine is, maybe you can't see that, you can see it. So it's the BBR. So it's going to be that gray shade. And I'll break it down in a bit, but that's the berberine group. At 15 minutes, 30 minutes, following a glucose load, the glucagon levels were determined in blood and tissues. They also looked at the GLP-1 levels, which we see here. So if you want to look at the other kind of glucagon model, you'll see the study cited there. You can just check it out. So we know that berberine, maybe we didn't say this, but berberine actually induces GLP-1 secretion in the intestines by altering the gut bacterial profile. And then, like I mentioned, some specific strains of probiotics are also found to be beneficial in supporting that GLP-1 secretion. So the graphs you see, you have the portal vein here on the top left that says portal GLP-1. You have the ileum, which is the very distal portion of the small intestine. Then you have the proximal colon, so the very beginning of the colon at the very bottom. So the right is going to, the white bar graph is the control group CT. The black is the streptozocin, I can never say that one, control group. So streptozocin is a compound. I think it's extracted from like bacteria or yeast or fungi, and it's used in research models basically to induce diabetes. So when researchers want to study that, they'll just use that molecule. And then to the gray bar is the diabetic induced rats that were given berberine. So we have the white bar control group, so no diabetes, no berberine. You have the black, which is the diabetes control. Then you have the gray, which is diabetes berberine. So as you can see in the portal, and then also in the ileum and the proximal colon, more so in the ileum, the small intestine, and the portal vein, you'll see kind of a higher induction of that GLP-1 with the berberine, which is really interesting to see. So you have the diabetes control. They have the berberine release there. I mean, the GLP-1 release in the black, and then to the right, the gray bar, you see an even higher release when they're given the berberine. So this is just kind of showing that the berberine, the model of GLP-1 using berberine in diabetic-induced rats. So we see some of that effect there. And then at the very bottom, the proximal colon, and they're pretty even in terms of what you see released with the berberine versus just a diabetic control group. So again, this is an image just showing us that berberine itself in animal models has been shown to increase production of GLP-1 in the intestinal tract there. And so let's now take a look at a supplement that can also support healthier levels of GLP-1, which is obviously berberine. In a study published in the journal Phytomedicine, International Journal of Phytotherapy and Phytopharmacology, patients were given 500 milligrams of berberine orally 3 times a day for 12 weeks. And these were average age 40-year-old, categorically obese participants. And they found that after 12 weeks, 3 months, there's an average weight loss of 5 pounds per participant. There was a 23% reduction in triglycerides and a 12% reduction in cholesterol levels, which is pretty impressive, actually, especially when you look at kind of standard medications that are treating lipid levels. That's really impressive. And then also a 59.5% increase in calcitriol. So with no serious side effects and no changes in cardiovascular, liver, kidney function reported. And then just the downside to the study is a pilot study. So it was not blind, and there wasn't a control group, nor was it randomized. So it's not really gold standard for a study, but it's really useful information. And especially because there are very minimal side effects. I will say that really high doses of berberine for some people may irritate their belly, but I've not seen that, and maybe Dr. Chill can speak to his experience too, but I've not seen that with like a 1500 milligram total dose, and you're separating it out, so it's 500 3 times a day. This is a formula here that has 450, so I mean, it's relative in the first section, and then yes, okay, so 450 of the berberine from Indian barberry, and then you have another 550 milligrams from a few different plant extracts. So it actually has, what is that? It has 1,000 milligrams. So it's actually a little higher than what the study used in terms of that's per 2 capsules. So, okay. Yeah. So that's a really good formula there. Thorne's a great company to use. And then there are other ones as well that you can kind of source berberine for. I feel like most standardized berberine formulations are going to be right around 400 starting out at least. And then, like we said, the major mechanism for the GLP-1 with berberine is it induces secretion of the hormone GLP-1 in the intestines by altering the gut microbiome and protecting the colon enterocytes. So yeah, that's the supplement you can consider. There are other ones as well. And I'm curious, Dr. Chill, have you seen any adverse effects from like high dose berberine, or are you not dosing it high?
If it's going to be a higher dose, I like to separate them.
Yeah.
Right. And so I haven't really seen a lot of adverse effects. I love berberine.
Yes.
I am constantly working with practitioners who are doing weight loss programs with their patients, and they're often prescribing berberine, and they're seeing really great results with it. When I was working with weight loss patients, I often use berberine as well, and it was a great starting point while we were addressing the root causes. I actually had a friend of mine reach out to me about 6 weeks ago, and this guy, he could eat everything.
Yeah.
And he would eat like 2 large pizzas by himself. He didn't have a response to say, these are leptin resistance issues, saying that he was full. I just said, just try berberine. Here's a dosage. He sent me a text 2 days later, and he was like, I'm full, and
Wow.
I stopped eating. This has never happened before. What is this magic pill you gave me?
That's such a
And
wonderful story.
it
Oh,
was awesome.
wow.
And so it triggered that response for him, right? That
Yeah.
appetite control response, that leptin response where it says I'm full, and that's what GLP-1 does, and that's what berberine did. And then he reported back 3 weeks later, and he was like, I've already lost 7 pounds.
Oh,
And
wow.
he's
That's
like, I haven't really
impressive.
changed anything. It's just because I haven't eaten as much as I normally do.
Yeah.
And it was awesome.
Cool. That's
Berberine.
a wonderful story. Thanks for sharing that. Wow.
It's really awesome. So if you want to look at the study a little bit more, Jacob, can you put the study that Dr. Asia was referring to? This is all of the lipid lowering effects of berberine, along with some of the other information that she referred to. But berberine is awesome. This should be a good go-to for helping with your GLP-1s as an alternative. Obviously, we talked a lot about different weight loss suggestions and recommendations, especially with GLP-1. We dive into so many other aspects of the underlying causes for weight loss in the functional weight loss program. And let's pop up a picture of the weight loss program here. So if you want to get and learn more about the root causes of weight gain, metabolic dysfunction, autoimmune conditions, oftentimes those are all connected, right? We really want to invite you to check out the Functional Weight Loss Program. This is a certification program, and it's going to focus on helping you understand all of the different contributing factors, the different root causes of metabolic dysfunction, why your patients are gaining weight or they can't take their weight off. You're going to often hear from patients, they've gone to many practitioners and they keep having that yo-yo effect that Dr. Asia was talking about, or they have tried everything, right? They're working out, they're eating correctly, or what they think is eating correctly, and they're still not able to get off the weight because they're not addressing all of the root causes. And oftentimes it's multiple root causes. So what this certification program does, it's going to help you investigate all of those different contributing factors, what all of the different root causes may be, so you can properly address them and investigate them utilizing things like functional labs, and then coming up with a comprehensive treatment protocol for them, in which this weight loss program will discuss with you. It's a 2-month program. It's 100% self-paced. It's all online. We really work with you at bringing the full power of functional medicine into your community. We have many different healthcare providers in the program. We have physicians, we have nurses, we have NPs, PAs, pharmacists, and nutritionists. And the program is starting this week. We have, I think, 3 spots available. And then here is the link if you want to get more information on this. And is there a link, Jacob? Perfect. There is the link. We will keep that up there. But thank you so much, everyone, for being here tonight. Hopefully you learned a lot about GLP-1s. Now you have some strategies for some alternatives that you can bring back to your patients and start to use them right away. Berberine.
Yes.
Dr. Aza, do you have anything else you want to add?
No, I think this was fabulous. I think it was, straightforward and potent. Berberine fiber, super simple, right? Super low impact, low side effect, if you will.
Absolutely.
High impact, low side effect. I'll say that.
Right.
Yes.
High impact, low side effect. That's what we go for in functional medicine.
Yes.
Again, thank you so much for being here. We have some questions, so let's stay on a little bit longer. Can you use the same dose of dihydroberberine. What are your thoughts on this, Dr. Asia?
I wouldn't know. I took a class on dihydroberberine a while back, and I'm trying to remember like what the actual difference is. If it's like more bioavailable, has a higher absorption rate. But I would say if it's more bioavailable, has a higher absorption rate, you may get away with using less of it. Like if you look at the studies, the doses are around 1,500 a day broken up. You can probably do a little more than that or a little less than that depending on your patient. But I would say if it's a more bioavailable form, then you might just be able to kind of cut it in half and see where you get with that. But that's how I would answer it. What would you say?
Absolutely. That's actually it, right? It's a little bit more of a bioavailable form of berberine. The studies are still mixed about it. And so I've seen mixed results with dihydroberberine. I've seen some patients be able to do a lower dose and it works just as effectively. And I've seen some patients having to use the 1,500 dose, right? Okay. Or even a higher dose for the berberine to be effective. But that's just with our medicine in general. That's just with our approach in general, right? Everyone is going to be different. You're going to need to adjust these dosages based on your patient's issues, their conditions, and the severity of them.
Yeah, and I think it's always okay to start with less and titrate up, So, you can always play with that and see where you land. But yeah, I agree with you.
Absolutely. Good question. And another question that we have, can you take berberine while taking prescribed GLP-1s as adjunct to the therapy? What are your thoughts on this? And then I'll put in my 2 cents as well.
I have kind of mixed in a way because, I'll say this. I don't know if there are any current head-to-head studies or combination studies looking at the GLP-1 agonist plus berberine and if it enhances the effects of the medication, or if it kind of what they do together, if they're complementary or if they are adjunctive therapies. I would say berberine is not just something that's targeting GLP-1. So it has plenty of other different actions. So I have used it in people who have SIBO, right? And they're also using the GLP-1s, right? It's a different formulation, a different dosage. But I would say really this for me goes back to the art of medicine, right? And knowing your patient and how you want to target them. But again, I would say there would be a question of the appropriate dose of berberine if somebody's on a GLP-1 and then if they're microdosing versus actual, normal standard GLP-1 dosing. So yes.
Yes, absolutely. Just to kind of piggyback off of that, it's really, I see it helpful with a lot of digestive issues with patients who have dysbiosis, right? As well, because the berberine is impacting the dysbiosis and helping with balancing out the dysbiosis. Mm-hmm. And what functional medicine practitioners will often do is wean them off or take them off the GLP-1s with the berberine as an adjunct therapy while they're on the GLP-1.
Agreed. I like it.
And then Crohn's, the patient also has Crohn's. And so Crohn's is interesting, right? You have to look at everything that is going on. What is the underlying cause of the Crohn's, right? Obviously, there's an autoimmune component to it, but what are all of the other underlying factors, right? Yeah. So while it can be helpful in some patients with Crohn's, you really have to look at the patient and personalize it to them. What are their contributing factors? What is their severity? How long have they been on GLP-1s before? Have they tried berberine with it, right? So it's like all functional medicine, you have to look at the whole picture. So that's difficult to answer because it depends on the picture of the patient. Yeah. What are your thoughts with that too?
I agree. A significant amount of Crohn's patients have SIBO that you can just simply diagnose. It's really common in Crohn's patients. Mm-hmm. A lot of their disease is a small intestine. So I could see a use for the berberine, but again, I would say you'd have to see what the science says about the berberine and then the doses that are being used if there are combination studies, which I hadn't seen them recently. But I could see the thought of using it for Crohn's, but again, because it has similar impacts on that GLP-1, you want to just kind of be careful and think about things like hypoglycemia, right? Or is this kind of inducing some other side effect? And so, yeah, I think Crohn's is a different ball game. But yeah, I mean, it's worthwhile considering how to adjust that if you're going to do it.
Yeah, absolutely. And we have a few more questions here talking about berberine. Can berberine improve hemoglobin A1C? I did see a study on berberine and it helping with hemoglobin A1C, blood sugar, insulin sensitivity, along with lipid levels and GLP-1s, right? We actually discussed this in the functional weight loss program and go into these studies as well as in the advanced program. And so if you are in the advanced program, go into your microbiome modules and you will see some of these studies. If you're in the weight loss program, this will be in the microbiome and the gut health portion of that as well. And do you have anything to add to that?
I mean, you hit it right, the nail on the head. I mean, berberine has a lot of studies around berberine, blood sugar, right. A1C over time. So yes, it can improve that, like Dr. Chill said.
This is why we love berberine.
That's right.
Now, the next question is regarding the formulation of Thorne. Is there any advantage to this formulation? Thorne, berberine, dual action formula with phytosome plus botanical extract.
I mean, I just think you want to find a good professional quality brand, right? Thorne is one of them. Thorne's been around for a while. There are plenty of other ones as well. If you look at berberine formulations, they're pretty comparable. You may find different doses, but they're all, like I said, at least around 400 and some are a little higher. You'll see different plants that they're extracted from, but it's the same compound. So not necessarily an advantage. It's just a better quality formulation. I probably would do a Thorne over, I don't know, like a Walmart berberine, right, if that even exists, but you never know these days. But yeah, just kind of more professional quality brand.
Absolutely. And then if you're seeing a formulation, right, this is really going to be dependent if this is good for the patient.
Right.
Sometimes I like to just do one herb at a time to really know what is happening. I like a slow and steady approach with functional medicine instead of throwing everything in there. So sometimes I stay away from the formulations unless it's indicated for the patient.
I like that.
Any suggestions for how to improve GI discomfort that accompanies berberine? I tried it and the GI discomfort was overwhelming. That's a good.
Yeah, I would say probably if you're doing 2 capsules, which is like recommended per that dose, I would probably split it and just do one and see if your belly tolerates that one, and just split it up a little more throughout the day. If it's still an issue, I'd probably try taking it with a meal, preferably one that has a little bit of fat to it, to kind of help mitigate some of that. So that's what I'd recommend. I maybe timing of day also maybe something to think about. Maybe don't take it right before bedtime where it's just kind of sitting on your belly a little bit more, just with laying down. So I would try some little hacks like that. Yeah, that's what I'd say. What would you think?
Yes, absolutely. And if you're having some GI discomfort with berberine, it may be a part of a die-off symptom, right? Because berberine is impacting dysbiosis. So if you have dysbiosis, it may be a part of that Herxheimer reaction or that discomfort that can occur. So really starting slow and steady, starting with maybe 1 cap in the morning, or even like, as Dr. Asia was saying, splitting them up, or doing it every other day, really slow and steady with the berberine, lowering the dose, splitting up even the capsule, or going at a lower dose and finding a formulation. We showed the Thorne one, which is at 1,000 milligrams. Other dosages have 250 milligrams and 500, right? So maybe go for one that has a lower dose and try with the lower dose first while you're adjusting some of the GI discomfort. You may, if you're having dysbiosis, then you may want to look at things like activated charcoal to help with that Herxheimer reaction if there's a die-off symptom that's occurring with that.
Nice.
And then the other question, berberine, is it safe to take while a client is on insulin and metformin? She's trying to come off some of these meds. What have you seen with this clinically?
I would say that's a really, you have to be really like cautious with that scenario, right? Because insulin, metformin, the whole goal is optimizing blood sugar, right? So you don't want a patient's blood sugar to get so low. So I think this is a lot of times where that fine tuning comes in, and kind of having your patient keeping track of their blood sugar levels and make sure you're monitoring that and following that closely. There's no like yes or no answer to this question. It kind of goes back again to the art of medicine. I don't think there's enough literature out to say yay or nay, you definitely shouldn't do it because it causes this thing. I think it's just the biggest picture with taking all of these things that lower blood sugar is what happens if the blood sugar goes too low, or are you monitoring for that? So, I would say that's how I would frame it. I know a lot of people do bridging protocols where they will add in a small dose of a supplement and then titrate down the med a little bit to see if they can kind of, compensate for each other. So, I mean, if you were to do that, I'd probably start really, 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 really low. Make sure you're monitoring their levels really often, having them monitor their levels and things of that nature. But there's not really a yes or no, is it safe answer to that one, I'd say.
Yes, it really and depends. Are you the prescribing physician that is prescribing insulin and metformin? If you're not, you need to be working in conjunction with that prescribing physician, right? And collaborating with them and seeing if berberine is something that can be done, right? With this patient, because you have to kind of take everything into consideration for those types of patients. And if you're not the prescribing physician, make sure you're working with them and collaborating with them for that.
Agreed.
The other question is, how long would you do a trial of berberine before making changes or adding other supplements? That's a great question.
It depends. I'm kind of a kitchen sink gal. Just throw the kitchen sink. It depends on what's happening. Sometimes I'm just like, let's do one or two things. I think, again, this is back to the art of medicine and just how you choose to practice. I would say if somebody's using berberine and you're making metabolic changes, you probably already have them doing other things, right? So dietary protocols that are increasing fiber and supporting their microbiome. So you can do standalone. I would say if you wanted to do that, like we saw in the study, like 12 weeks is what they kind of study. So I typically will recommend at least an 8-week to 12-week protocol of using something. But a lot of the time with functional medicine, you want to get probably a little more maximal benefit within that window. So you can also do other therapies as well to support that overall metabolic picture, like things like fiber, right? Which is really gentle to support the same picture, but in a different way.
And for me, I like to start with a lower dose, right? Or the dose that is recommended. And you can always go up.
Yep.
And so what I typically will see with supplementation is you give it at least 4 to 6 weeks to take effect. It takes about 4 to 6 weeks to take effect. Sometimes longer, sometimes shorter. This is what you're setting the expectations with your patients on. In that 4 to 6 week follow-up, if you're not seeing the changes that you want to see, the improvements that you want to see, then you might want to increase the dose or add in other supplementation at that point.
Love that.
Any other questions? We'll give a couple of moments here to add in other questions. Okay, it looks like no more questions. Those were awesome.
Really active today.
Questions.
Yeah, I love it. Yeah.
Everyone, thank you again so much for being here. Dr. Asia, it's always great to be on this podcast with you. This is the second time we're doing it. It was so fun.
Yes, agreed. Thank you so much.
And everyone else, have a great rest of your day, your evening, whatever time it's at with where you're located. And we will see you in the next podcast. Thank you so much for being here.
Thanks, everyone.